My loved one has been receiving hospice care for some time now, and recently I've noticed a disturbing change in their physical appearance. Their feet and the palms of their hands have taken on a reddish hue, which is alarming to say the least. Furthermore, their fingertips appear reddish and blotchy, and they feel cold to the touch. However, when I hold their hands, they seem to warm up slightly, although the blotchy color remains. I've been doing some research and I'm worried that this could be a sign of mottling, which I understand is a common phenomenon that occurs in the final stages of life. The thought of losing my loved one is devastating, and every little change I observe makes me even more anxious. Despite my concerns, the hospice caregivers assure me that my loved one is stable. However, I've noticed a steady decline in their overall health, and I'm finding it difficult to reconcile the caregiver's assessment with what I'm witnessing firsthand. As a result, I'm finding myself obsessing over every minor change, no matter how insignificant it may seem. My greatest fear is that my loved one will pass away alone, and that thought keeps me up at night. I'm desperate for answers and reassurance. Has anyone else experienced something similar? Is mottling always a sign of impending death, or can it be caused by other factors? I need to know what to expect and how to prepare myself for the inevitable. Today we know all about mottling skin and sign of death. Let's get started. Mottling of the skin is a sign that the end of life is near, and unfortunately, it's not possible to reverse or treat it. At this stage, the underlying illness has progressed to the point where cardiac output is severely impaired, and the body's functions are shutting down. Most patients with mottled skin have stopped eating and drinking, and their breathing has become irregular and shallow. They may also be unresponsive or unable to communicate effectively. As the heart weakens, blood flow to the limbs decreases, causing them to feel cold. Providing comfort and warmth is the primary focus of care at this stage. Wrapping the patient's limbs in blankets can help keep them warm, and assistance with movement is crucial to prevent falls due to poor circulation and low blood pressure. While some patients may still be able to stand or move around, they should always be accompanied by a caregiver to ensure their safety. Mottled skin is a condition characterized by a blotchy, red-purplish marbling of the skin. It often appears first on the feet and then travels up the legs. Mottling of the skin before death is common and usually occurs during the final week of life, although in some cases it can occur earlier. Mottling is caused by the heart no longer being able to pump blood effectively. As a result, blood pressure drops, causing extremities to feel cool to the touch. The skin then starts to become discolored. Mottled skin before dying is very common, but patients' families are often concerned that mottling is painful for their loved one. However, mottling does not cause any pain for the patient, although they may feel cold, particularly in the legs and arms. As a caregiver, you can help the patient by covering them with a warm blanket and being there to address any needs. Holding their hand and speaking in a normal tone of voice can also be comforting, even if they are unresponsive. Mottling of the skin occurs during the last week of life. Although there is no exact timeline, it can occur in the final week or not until the final hours. Caregivers should also look for other end-of-life symptoms, including changes in breathing and diminished food and water intake. While mottled skin is a strong indicator that death is imminent, it's essential to look for other signs, including changes in breathing, diminished food and water intake, increased fatigue, decreased responsiveness. Mottling of the skin, also known as livedo reticularis, is a distinctive discoloration of the skin. Healthcare providers diagnose livedo reticularis by looking at the skin. They may review the patient's health history and any chronic illnesses they've had. A skin biopsy or lab studies, such as urinalysis or blood tests, may also be necessary. The best therapy for mottled skin depends on the type. Primary livedo reticularis. Gradually warm the affected area by taking a shower or bath. Secondary livedo reticularis. Symptoms should improve by treating the underlying condition. Congenital livedo reticularis. This condition goes away on its own but may take time. While some types of mottled skin can't be prevented, others can. For example, primary livedo reticularis can be prevented by not exposing the skin to cold environments. Secondary livedo reticularis may be more challenging to prevent, but following care instructions closely can help. Contact your healthcare provider if you notice a dark, lace-like pattern on your skin. Since livedo reticularis can be a sign of many medical issues, a timely assessment is essential. Mottled skin causes patches of discoloration in a lace-like pattern, with pale skin at the center. The reticula may be reddish blue or purple and may come and go. Symptoms often affect only certain areas of the body, like the lower limbs. Mottling of the skin near death signals that death is imminent. The hospice team will be on hand to ease the transition and keep the patient comfortable. Families need to prepare themselves for their loved one's demise, saying their final goodbyes and expressing their final thoughts before they go. Mottling of the skin indicates that the patient does not have much longer to live. Families should alert relatives and friends so they can come pay their final respects. Parents may want to sit down with young children and prepare them for the reality of death. Adults and older children can turn to the hospice chaplain if they need help processing their grief. Mottled skin is a common condition that occurs before death, usually during the final week of life. While it can be a sign of imminent death, it's essential to look for other signs and symptoms. Caregivers can provide comfort and support by covering the patient with a warm blanket, holding their hand, and speaking in a normal tone of voice. Families should prepare themselves for their loved one's demise, saying their final goodbyes and expressing their final thoughts before they go.